Many years ago, whilst I was a very junior medical student, I've had the opportunity to visit a theatre, and it was a random allocation, and it was a knee replacement procedure. My exposure to to surgery was minimal at the time as a first year medical student, but it impressed me how quickly you can change someone's life by literally using a hammer and a saw and some cement and some metal. And also at the time, it reminded me that it looks very much like carpentry, um, more or less. However, I was attracted instantly. It was I would say love at first sight, and ever since that's all I wanted to become. And eventually, with hard work and consistency, I've achieved that. Day to day, I find that treating various type of patients with various knee problems, in my case, when they come back a few weeks after surgery, they are most of them very grateful, and what gives me satisfaction is their gratitude and their sincere thank you. You have given my life back, and that wipes away all those long hours standing, long hours in the clinic, many years of learning and exams and fellowships. So having those patients which come to see you first time with walking sticks or in a wheelchair, and then come back a few weeks after surgery, standing straight and no walking aids, smiling with their face, and giving you a hug. Thank you for giving me my life back. Those are the moments which are worth making this job I'm doing worthwhile. I think my patients, they like me being open and honest with them, and telling things straight in their own language, because very often these days clinicians tends to be to forget that in front of them there's a patient with no medical background or medical knowledge. So taking a moment and speaking to them in simple terms, taking the time to explain what this problem is and what are the options, and allowing them and helping them to make an informed decision about their management, I think it's very important. So this is one of the things that my patients value me for. Being a knee surgeon with a specialist interest in joint preservation and soft tissue reconstruction, the biggest challenge is to create or recreate their patient's ability to resume their high intensity activities. I see very young patients, from teenagers to middle-aged, mostly men, with very high expectations of returning to sport, high intensity, and a lot of it. So meeting those expectations, it's one of the challenges, but equally making sure that the patient's expectations are realistic and achievable ones are, I think, the significant or the biggest challenge in my practice. The second biggest one is to be able to guide them the right way without the patient being feeling that they are pushed or made to choose in a certain way because I decided to do so. So I'm trying to be as neutral and as professional as possible, and allowing them to providing them with enough information to for them to make the right decision for their circumstances.